to describe the diabetes prevention program that we have been involved with. Can everybody see the slide?
Not yet.
Serve the Texas Rio Grande Valley, and sorry about the technical problems. Okay, here we go. So if you can see the map there of Texas, we are way at the bottom there, the tip of Texas along the Mexican border. We serve Willacy and Cameron County. Last year, we served about 31,000 patients, and we have very comprehensive services, including medical, dental, behavioral health, women's health, and lots of support services at the clinic. We were founded in 1971, so it's a long time ago. We were among the first National Health Service Corps sites in the United States. We were among the first migrant health centers in the United States, and we have the designation as a health center quality leader from HRSA. We are recognized as a patient-centered medical home through the National Committee for Quality Assurance, and we are partners with Unidos Us. We are an affiliate. As a matter of fact, it was Unidos Us that actually approached us about a year and a half ago and letting us know about the DPP program and how the CDC and the American Diabetes Association was interested in looking at counties in Texas that did not have a DPP program, and they were sharing this with us to see if we might be interested in participating, which we were. So a little bit about diabetes in South Texas. It's an enormous problem. The prevalence is estimated at about 27.6% among all adults. In the region, over 1 million people. So that equates to about 307,000 persons with diabetes in our area. An estimated 74.7% of adults in South Texas are overweight or obese, which significantly is higher than the state of Texas and in the country. The risk of dying from diabetes was higher in South Texas than the state overall, about 38% higher. So as you can see, we have very, very high prevalence of diabetes. 1 in 3 individuals at Su Clinica have diabetes, which is approximately 6,000 patients. 1 in 2 have diabetes or prediabetes, which is 9,440 patients. And 31% are diabetics and 31% are hypertensive. So that just gives you an idea of the load of chronic illness that we have in our community and the challenges and the barriers that we have in trying to manage and improve the health status within our community. So, and actually I just wanted to mention, you know, we spent so much time looking at how we could control diabetes, and every year it seemed like there were just more and more people with the diagnosis of diabetes, and it was getting harder and harder for us to manage this chronic illness. We didn't even know how many pre-diabetics we had, and about a couple of years ago we actually looked at that, and we were just astonished at how many individuals were pre-diabetic and at risk for actually moving on to becoming a diabetic. We're going to skip over this slide, but what I just wanted to clarify for you is when you look at the A1C levels, anything that is above, is 6.5 or above is diabetes, and your hemoglobin A1C levels that are between 5.7 and 6 0.4 puts you at being a pre-diabetic, and that risk is moving along into the diabetes diagnosis. So that's the area that we're focusing on. Now, what are we doing to address diabetes? And I would just want to say that, as many of you know, we can't do it alone. We can't do it by ourselves. The number one partner we need are our patients, but we can't just partner with our patients. We have to partner with our community and with other institutions, because this is a phenomenally difficult challenge. So at Su Clinica here in the lower Rio Grande Valley, we have partnerships with the University of Texas, the School of Public Health. There are many, many programs we work with them on, the 1115 waivers. We have diabetes salud y vida programs where we look at promotoras that help us with diabetes education classes, cooking classes, all kinds of things going on with that partnership. Unidos contra la Diabetes is a regional program that basically partners get together and talk about resources within our region to bring awareness about prediabetes to the community, and meet and discuss challenges and opportunities. We have Methodist Healthcare Ministries. We work with them on some grants that include taking care of diabetics with mental health disease and other behavioral health disorders, and with Unidos Us, and then It's Time Texas is a program that we work to help keep our own employees healthy and bring awareness about chronic diseases such as diabetes and hypertension. But we saw a need to do more, and as I mentioned before, it was a time at Su Clinica that we really wanted to start looking at how we can control just the sheer numbers of people that were becoming diabetic. As I mentioned before in one of our slides, we have 74% of our patients that are overweight or obese, and that we were having challenges controlling. All of the risk factors were very challenging, and we wanted to do something that would actually get at the root cause of the diabetes and try to reverse and prevent diabetes. So I'm going to talk a little bit about our diabetes prevention program. And one of the areas that we serve is Willacy County, and that is one of our rural communities. 37% of the people there are living in poverty. The median age is about 33.6, and the median family income is $28,817, making it the 5th worst country in the United States. The county lacks the basic knowledge and understanding of what diabetes is and the complications that come with it. And since they were trying to target counties in the United States that did not have a diabetes prevention program, Willacy County came up on the radar, and we were very happy to focus on that particular area of their service area. So why is diabetes prevention important? More than 30 million Americans have diabetes type 2, which increases their risk for many health problems, including blindness, kidney failure, heart disease, stroke, loss of toes, feet, or legs. And I wanted to just take an opportunity to just let you know about another project that we were involved in recently. And we were in partnership with the School of Public Health, and we screened over 1,000 diabetics with portable cameras, taking retina screens and digital photographs of our patients that had diabetes. And many of our patients do not have the funding or access to see an ophthalmologist. And so in partnership with the school, we did that. Over 1,000, half of them had pathology, and 129 of those individuals had pathology that was severe enough that we needed to send them urgently to a retinal specialist. We raised some funds to help get our patients over there that truly needed it. And so these are just some of the things that we do in partnership in taking care of our diabetics. But these are the kinds of complications that we see, and these are the kinds of complications that need to be addressed and prevented. As I mentioned, 30 million Americans have diabetes, but look, 86 million Americans have prediabetes, more than have diabetes, and they're hiding from us. They're hiding from us because they do not know or are not aware of what prediabetes is, and they're not being screened. And so with this diabetes prevention program, this is an opportunity for us to go out there in the community, in our workplace, in the schools, and really push the awareness of what all of this means, and that we can reverse prediabetes and make it more difficult to actually moving on to becoming a diabetic. And we may not be able to change the genetics, but we can change the lifestyle of people and really have a major impact, and that's what we're trying to do here. The Lifestyle Change Program at Su Clinica, what I really like about it and the CDC program is that it's evidence-based. There are a lot of things going on across the country. Lots of people are trying to get their arms around this epidemic of diabetes. But what I really love about this is that there's research that has actually shown that the curriculum that is being used is evidence-based and it actually shows results. So, for example, weight loss of 5 to 7% of the body weight achieved by reducing calories and increasing physical activity to at least 150 minutes a week resulted in a 58% lower incidence of type 2 diabetes. For people 60 and older, the program reduced the incidence of type 2 diabetes by 71%. And after 10 years, Lifestyle Change Program participants had a 34% lower incidence of type 2 diabetes. So this is something that has been tried and has worked. And that's why we were so excited about bringing that program to our community. So what are the risk factors for prediabetes? If you're older than 45, you're overweight, you have a family history of type 2 diabetes, mother, father, sisters, brothers, are physically active less than 3 times a week. If you had diabetes while pregnant or you gave birth to a baby that weighed more than 9 pounds, you're at risk for prediabetes. And this is a prediabetes screen that we use for our community. And it's very easy. You just answer the questions, and there are points associated with yeses and nos. And if you look at the right-hand side, there is a scale. You find your height, and you look at your weight. And if you're in a particular range, you just add the points. And if you're less than the weight in the first column, then you get 0 in as part of your score. If you score 5 or higher, you're at risk of prediabetes. And so this is given out to the communities. You can give it out to your staff, to your schools. You can really promote this as an awareness of prediabetes and what you can do about it. So this is a program that works, and we will show you that in a moment. I have Marlen here and Lino here, and they're going to talk to you a little bit about how it works at Su Clinica, what our challenges were, what some of our successes were, and where we're going from here. So, Marlen, you want to talk a little bit about the program? First slide?
Yes, thank you, Dr. Marin. So a program that works, there are a lot of programs and grants out there, and what has worked for us is an evidence-based curriculum created again by the CDC and supported by the ADA. This program consists of 6 ingredients. The first one is an evidence-based curriculum. The second one is a lifestyle coach and they work with participants. They invest in their success, and they are with them through every step of the way. The third one is awareness and education. Participants attend sessions and work with their lifestyle coaches. As they attend the sessions, they're becoming more aware of what it means to have prediabetes and their personal risk for type 2 diabetes. This type of education helps them understand the importance of leading healthier lives. The next ingredient is the network of support. Participants will have a network of support. They join small groups, and they now become aware that they're not alone. They share the same challenges, the same struggles, and together they work towards the same goals and build confidence for each other. The next one is the tailored community resources. At Su Clinica, we have collaborated with other community resources to improve the quality of our participants. However, just keep in mind that what has worked down here in our area, it doesn't mean it's going to work in your community. So it's just really important to take that into consideration. And the last one is with continue education and follow-up. Many programs start and they end, but we never follow up. What we need to do different here is to continue to provide education to the community, to continue to follow up with our participants, continue to be involved. Community support. What we did here at the Clinica, we created an external community advisory committee that consisted of city leaders such as mayors, city commissioners, school officials, that consisted of superintendents, principals, school nurses, and teachers. Also community leaders such as business owners. And then we also joined our regional support coalition, Unidos contra la Diabetes. With them, we connected, and what we did is we shared ideas, what worked in other programs, and what didn't work. Here's an example of some of the flyers that we created for our events to make them aware of the program when we started. And so the flyers were distributed throughout the different schools, different businesses, and that's how we started our first event here in the Willacy County.
The results for the first year were 225 participants. The average percent reduction in body weight was 4%. The average weekly time of physical activity was 185 minutes. We got an overwhelming support of community leaders here in Willacy County that really went out of their way to help this program become a success in their community. Some of the community leaders, they saw a barrier that we're going through year one, where some of the participants were having trouble making the sessions or participate in the program. So they were kind enough to open the doors of locations so we could take the program to the participants, making it easier for the participants to attend. In turn, we had a bigger increase of participants for year two. And we also developed MOUs with the local school districts. As we mentioned earlier, the superintendent was part of the community advisory board, and he was kind enough to, open the school district for us, where we developed some MOUs, and we took the program into the school districts. Considering the fact that now we live a busy lifestyle, and sometimes we don't have, we're always on the run. Making this change where we take the program to the business, or we take the program to the school district, making it easier for the participants, it really did change the program around. And because of the demand that we're getting and the word of mouth that we're receiving throughout the county and neighboring county, we have a possibility expansion to a neighboring county in the coming year three. bringing more participants into a program and helping people make a lifestyle change, helping people prevent diabetes, and letting people know that diabetes is not their destiny. And as a result, hopefully in year three, we are close to being recognized by CDC as a recognized program. So therefore, we're exploring to Medicare reimbursement to be a sustained program moving forward to have more success. However, like any other program, we have barriers and challenges. Participants want overnight results. They want overnight change, and with anything that's going to be a lasting lifestyle change, we know that overnight results, it's nearly impossible. Men, another barrier was the men are hard to recruit in our area. For year one, we learned that we were targeting men, and we learned that the men weren't really, buying into the program. So for year two, we switched it up and targeted females. In turn, the females would bring men who will encourage their husband. So we had a bigger increase in year two for men participation. Another challenge we had was 1 year commitment to the program. Some of the participants felt that the 1 year commitment to program was a long time. So for year one, for year two, we decided to okay, instead of calling a 1 year commitment, we can
Housekeeping Women's Health, Housekeeping Women.
sorry about that. Instead of calling a 1 year commitment for year two, we'll call it a 12-month program, making it a little bit easier. And even like that, we ran into a barrier that, participants were still finding the 12 months very, very long time. So we changed the wording again, and we let participants know that in reality, it's only 26 hours. 26 hours out of the 12 months. And 26 hours, so 1 hour, we spend 1 hour looking at Facebook, looking at social media. So 26 hours go by real quick. But because we can't do 26 hours in 1 day or 2 days, we decided to cut the 26 hours within the 12 months, where participants attend sessions, weekly sessions for the first 6 months, and then they attend one session 1 time a month for the last 6 months, making it easier, making it a little bit more digestible for the participants. Another challenge we had was transportation. Like we mentioned earlier, Willacy County is the fifth, of course, county in the U.S., and there's a lot of households that share one vehicle, and they have 8 siblings, or they have grandma, grandpa, uncle, aunt living in the same household, and they only have one car. So it was a little bit difficult coming to the session. That's why coming to them through the school districts or through the businesses and providing the program at their site was also overcoming that challenge. Childcare. Childcare was another challenge that we also faced. In Willacy, we have dad working 8 hours, 9 hours a day, and mom is taking care of the young ones at home. Or after work, mom has to go and attend to the young ones, and there's really no time to come to the program. So that's why bringing the program to the business, or bringing this a program to teachers at the school districts, or bringing the programs to them made it easier for on Saturdays, bringing the program on Saturdays as well, and looking into Sundays. It made it easier for participants to attend. We also had family support. Family support was a barrier and a challenge because we have mom that wants to do a lifestyle change, but we have dad buying Whataburger or buying a fast food food. We have quite possibly dad wanting to make a lifestyle change, and he sees that his kids not ready to make the change, so it makes it a little bit easier. So in this program, family support is a big ingredient where it has to be a family event, it has to be a family lifestyle change for them. Another barrier and challenge was overcoming convenience of fast foods. Nowadays, we're extremely busy, we're on the go, and the easiest thing is to go through a drive-through and buy a fast food. But what we're doing in this program, what we're doing different in this program, we're teaching participants, we're teaching them to make healthier choices, we're teaching them how to read the labels, we're teaching them to be a little bit conscious of what they're going to buy at a fast food place. We're teaching them just because it's cheaper does not mean it's healthier. So we're teaching these things to participants so they can make a lifestyle change and help them prevent diabetes and help them decrease that 5% of weight loss. Here we have a success story. The success story, she's a working wife, mother of three. When she started the program, she started weighing at 190 pounds. She's 5'3". She enrolled after her husband enrolled. She was tired of being overweight, tired of being out of energy, hiding for pictures. She had a low self-esteem and ashamed of what she had let herself become throughout the years. When she finished the program, her ending weight was 115 pounds. Now, if you see her, she's full of energy. She has mental clarity. She enjoys taking pictures, especially with her family, with her daughters and husband. She has a high self-esteem, and she is extremely proud of what she has accomplished. So this is Analisa. As you can see, back in August, she was weighing more than 190 pounds. So she made an attempt already to do a change, but she had reached a plateau, and then she enrolled in the program at 190 pounds. At November, she had made a drastic change, and when she finished the program, she was at 115, and she has maintained at 115 since. But the bigger part about Analisa is that she has become a big part of the program by being an advocate in her community. A lot of people in her community see her, and they ask her, "Wow, Analisa, you have changed. What are you doing?" And she shares the program with them. She shares about the challenges that she faced, the barriers, and how she overcame them, and how the lifestyle coaches were there to help her out. How she had to make a sacrifice for her. She had to sacrifice for her family, for the better of the health of her family, and a different lifestyle, because she was on the path of developing diabetes if she had not enrolled in the program.
So what we want to say is that the benefits are real for making a lifestyle change. We need to take action. And now we want to challenge you to take action to educate your community about prediabetes and the importance of preventing type 2 diabetes. Encourage your members and other groups to share information about prediabetes. Share the prediabetes screening test throughout your community, and motivate people with diabetes to join a lifestyle change program. It worked for us, it can work for your community as well. Here's some of the resources that we've shared with you from the National DPP website. There's the link, and you'll find information about prediabetes and type 2, diabetes research and other statistics, lifestyle change program details, testimonials, locations of other programs just like our program across the country, and other resources. Here's our information. If you have additional questions, we have provided you with our link to our website, also our phones and extensions, and our email addresses.
Thank you so much. We would be happy to entertain any questions.